In today's video, we are going to share with you some useful information about menopause that you should know to better deal with it when you are in this phase in your life or if you're already experiencing it. The one thing you need to know about menopause is it's a natural phase in a woman's life that marks the end of her menstrual cycles and her reproductive years. It officially begins when you've gone 12 consecutive months without a menstrual period. Menopause usually begins in your 40s or 50s, but can develop before or after this age range. Menopause is a natural biological process that occurs as the ovaries age and produces less reproductive hormones. But the physical symptoms, such as hot flashes and emotional symptoms of menopause, may disrupt your sleep, lower your energy, or affect emotional health. In particular, symptoms like night sweats are common right before, during, and after menopause. Natural remedies can help in most cases. Menopause can cause uncomfortable symptoms such as weight gain. For most women, medical treatment isn't needed for menopause. Signs and symptoms including changes in menstruation can vary among women. Most likely, you'll experience some irregularity in your periods before they end. Skipping periods during perimenopause is common and expected. Most of the time, menstrual periods will skip a month and return, or skip several months and then start monthly cycles again for a few months. Periods also tend to happen on shorter cycles, so they are closer together. Despite irregular periods, pregnancy is possible. If you've skipped a period but aren't sure you've started the menopausal transition, you can consider a pregnancy test. There are many factors that help determine when you'll begin menopause, including genetics and ovary health. Perimenopause is a time when your hormones begin to change in preparation for menopause. It can last anywhere for a few months to several years. Many women begin perimenopause at some point after their mid-40s. Other women skip perimenopause and enter menopause suddenly. About 1% of women begin menopause before the age of 40, which is called premature menopause or primary ovarian insufficiency. About 5% of women undergo menopause between the ages of 40 and 45. This is referred to as early menopause. Let's take a look at some of the common causes of menopause. Naturally declining reproductive hormones. As you approach your late 30s, your ovaries start making less estrogen and progesterone, which is the hormones that regulate menstruation, and your fertility declines. In your 40s, your menstrual periods become longer or shorter, heavier or lighter, or more or less frequent, until eventually your ovaries stop releasing eggs and you have no more periods. Surgery that removes the ovaries. Your ovaries produce hormones that regulate the menstrual cycle. Making surgery to remove your ovaries causes immediate menopause. Your periods stop, and you're likely to have hot flashes and experience other menopausal signs and symptoms. Signs and symptoms can be severe, as hormonal changes occur abruptly rather than gradually over several years. Surgery that removes your uterus but not your ovaries usually doesn't cause immediate menopause. Although you no longer have periods, your ovaries still release eggs and produce estrogen and progesterone. Chemotherapy and radiation therapy. These cancer therapies can induce menopause, which can cause symptoms such as hot flashes during or shortly after the course of treatment. The halt of menstruation and fertility is not always permanent following chemotherapy, so birth control measures may still be desired. Radiation therapy only affects ovarian function if radiation is directed at the ovaries. Radiation therapy on other parts of the body, such as breast tissue or head and neck, won't affect menopause. Primary ovarian insufficiency. About 1% of women experience menopause before age 40. This premature menopause may result from the failure of ovaries to produce normal levels of reproductive hormones, which can stem from genetic factors or autoimmune disease. But often, no cause of premature menopause can be found. Women affected by this type of menopause are required to follow hormone therapy at least until the natural age of menopause in order to protect the brain, heart, and bones. After menopause, your risk for certain medical condition increases. Some of these are Heart and blood vessel disease. When your estrogen levels decline, your risk for cardiovascular disease increases. Heart disease is the leading cause of death in women as well as in men, so it's important to get regular exercise, eat a healthy diet, and maintain a normal weight. It's a good idea to look for advice from your care provider on how to protect your heart, such as how to reduce your cholesterol or blood pressure if it's too high. Osteoporosis. This condition causes bones to become brittle and weak, leading to an increased risk of fractures. During the first few years after menopause, you may lose bone density at a rapid rate, increasing your risk of osteoporosis. In the post-menopausal period, women with osteoporosis are especially susceptible to fractures of their spine, hips, and wrists. Urinary incontinence. As the tissues of your vagina and urethra lose elasticity, you may experience frequent, sudden, strong urges to urinate, followed by an involuntary loss of urine, or the loss of urine with coughing, laughing, or lifting. You may have urinary tract infections more often. Strengthening pelvic floor muscles with Kegel exercises and using topical vaginal estrogen may help relieve symptoms of incontinence. Hormone therapy may also be an effective treatment option for menopausal urinary tract and vaginal changes that can result in urinary incontinence. Sexual function. Vaginal dryness from decreased moisture production and loss of elasticity can cause discomfort and slight bleeding during sexual intercourse. As well, decreased sensation may reduce your desire for sexual activity. Water-based vaginal moisturizers and lubricants may help. If a vaginal lubricant isn't enough, many women benefit from the use of local vaginal estrogen treatment, available as a vaginal cream, tablet, or ring. Weight gain. Women may gain weight during the menopausal transition and after menopause because metabolism slows. You may need to eat less and exercise more just to maintain your current weight. Keep in mind that every woman is different and each of them may experience these complications differently. The most important is to take accountability for the changes and take appropriate steps to deal with them. There are a variety of ways to deal with menopause when symptoms occur. Here are some at-home tips for managing menopause symptoms. Keeping cool and staying comfortable. Dress in loose layered clothing, especially during the nighttime and during warm or unpredictable weather. This can help manage hot flashes. Keeping your bedroom cool and avoiding heavy blankets at night can also help reduce your chances of night sweats. If you regularly have night sweats, consider using a waterproof sheet under your bedding to protect your mattress. You can also carry a portable fan to help you cool down if you're feeling flushed. Exercising and managing your weight. Reduce your daily calorie intake by 400 to 600 calories to help manage your weight. It's also important to exercise moderately for 20 to 30 minutes a day. This can help increase energy, promote a better night's sleep, improve mood, and promote your general well-being. Communicating your needs. You may need to talk to a therapist or psychologist about any feelings of depression, anxiety, sadness, isolation, insomnia, and identity changes. You should also try talking to your family members, loved ones, or friends about feelings of anxiety, mood changes, or depression so that they know your needs. It's worth communicating about it to people close to you that you trust. It can make a difference. Supplementing your diet. Take calcium, vitamin D, and magnesium supplements to help reduce your risk of osteoporosis and improve energy levels and sleep. You may talk to your care provider about supplements that can help you with your individual health needs. Practice relaxation and breathing techniques, such as yoga, box breathing, and meditation. It can be useful in this process. Taking care of your skin. You can apply moisturizers daily to reduce skin dryness. You should also avoid excessive bathing or swimming, which can dry out or irritate your skin. Managing sleeping issues. You may use appropriate sleep medications to temporarily manage your insomnia. Consider discussing natural sleep aids with your care provider. Talk to your doctor if you regularly have trouble sleeping so they can help you manage it and get a better night's rest. Quitting smoking and limiting alcohol use. It is advisable to stop smoking and avoid exposure to secondhand smoke. Exposure to cigarettes may make your symptoms worse. Reduce alcohol intake. You should also limit your alcohol intake to reduce worsening symptoms. Heavy drinking during menopause may increase your risk of health concerns. Menopause is not a disease or a condition to be feared, but it is a natural transition in a woman's life. With proper care and support, women can navigate this stage with confidence and embrace the new opportunities and experiences that come with it. It is important to remember that every woman's experience of menopause is unique, and seeking personalized advice and support is crucial for a smoother transition. That's it for the video today, and I hope you got value from it. Don't forget to subscribe to the channel, hit the like button and the notification bell so that you never miss out on any new informative video uploaded. Remember, your health is your priority. I'll see you in the next informative episode.